You mentioned some labs there that you test for heavy metals. I'd like to know about the labs you use to determine the extent to which people have problems with their heart, the LP little a, the HDL to triglyceride ratio. What kind of markers are you using?
Yeah, well, the ones that go beyond the ordinary are everybody gets a vitamin D level, and that's rather trite. But particularly with the pandemic, we know getting COVID with a low vitamin D level is just unwise. And getting in a level, at least the way we report in the States, of 50 to 70, I think it's milligrams per deciliter is optimal. That may take 5,000 international units a day of vitamin D3, which I don't consider a high dose, but it's pretty much my routine. Homocysteine, a metabolic marker of something called methylation, you might inherit from your parents or have an alteration in your diet or your vitamin levels. Homocysteine, you don't want it sky high. It's not good for your blood vessels and many other body functions. You mentioned a genetic cholesterol called lipoprotein A. I had the pleasure a year ago of writing a book so that everybody can at least see the word lipoprotein A. About 1.5 billion people inherit this cholesterol from their mom, their dad, or both. It can damage arteries anywhere in the body. It can damage a heart valve. It's a very inexpensive blood test, but most primary care practitioners and even cardiologists don't order it. Big pharmaceutical companies are developing drugs to lower that cholesterol because the ones we have out now don't lower it and sometimes even have the opposite effect of making it worse. So we need a whole new class of pharmaceutical agents, and they'll be coming out in about 3 or 4 years if these studies go well, international studies. I'd like a test of inflammation. I want to know if your diet, your dental health, your sleep, your skin, your food is working for you. So high sensitivity C-reactive protein, HSCRP. And maybe the last one, if you can get it, the most common nutritional deficiency is actually low omega-3. And we talk a lot about vitamin D and vitamin B12, vitamin C, zinc, but low omega-3. And omega-3, which we can't make as humans, EPA, DHA, DPA, we have to either eat it or take it. So we either have to eat salmon, sardine, mackerel, herring, not tuna, because tuna doesn't have much. Or we have to do a lot of chia seeds, flax seeds, hemp hearts, walnuts, leafy greens, chlorella, spirulina. Or we got to take fish oil or vegan capsules. But it's unbelievable how low people are. And their cholesterol numbers improve, their inflammation numbers improve. Sometimes their memory seems a little sharper because the brain is so dependent on EPA, and people don't talk about it much. I'm not saying go out there and go buy gigantic barrels of fish oil, but if your practitioner will run a blood level or make sure you get a couple tablespoons a day of ground flaxseed, all would be good choices.